Hosparus Health is dedicated to providing comprehensive, compassionate care that addresses not just the physical, but the emotional and spiritual needs of patients and families as well. In this giving season, you can help support the work that they're doing. Joining us today with more is Chief Development and Marketing Officer, Tawanda Owsley. Tawanda, always great to see you, especially this time of year. It's so important.
Yes, thank you for having us.
So tell me a little bit about what is this Places of Compassion campaign that's going on?
We are so excited to launch our Places of Compassion campaign. We are on the third capital project of that campaign.
Wow.
The first project was a primary all-inclusive care for the elderly in Elizabethtown. The second project was a grief counseling center in the Louisville market, and our third project is a brand new inpatient care center that's going to be in our Louisville area.
How does that inpatient care center kind of fit into the big puzzle that is Hosparus and the work that you all do?
Well, many people know us because of our hospice care and our serious illness care. We're there for families at the most tragic times of end of life. With our new inpatient care center, we will be able to provide a more comprehensive care for those facing serious illness and end of life at those last moments. So most of the time, the folks that are in our inpatient care center, their medical needs far exceed what a loved one could do at home. So they have more complicated medical conditions. So in our inpatient care center, you'll have our team of physicians and our team of caregivers that will be able to provide care in a home-like environment outside of the hospital setting, and it will be specialized and it will deal with those most complicated issues.
I was going to ask, and you kind of answered it there,
Yeah.
the difference between being in that traditional hospital setting. Again, it's so important to feel like you are at home and
Yes.
comfortable, and that's where you all make that very different.
Absolutely. We'll be accessible. We'll be within the Watterson off of Dutchman's Lane on our Ephraim McDowell campus. So it'll be one level parking lot entrance from outside. It'll definitely be more like a retreat experience. Your family can join you as you're dealing with that loved one that's at their last moments of life.
Mm-hmm. How many beds will you have there?
We'll have 21 beds, over 20,000 square feet. We'll have an open entryway that is a home-like environment. We'll have a kitchen that will allow families to be able to prepare meals with those loved ones at the end of life. It'll be a really caring space.
Mm-hmm. I feel like every year we've had you on, you all continue to grow and to grow and to grow because the need is really there.
The need is growing. We are seeing more patients than ever and more complicated care issues than ever. So our patients are sicker and they're living longer, which is a good thing. But when they get to those last moments of life, which can be the last 6 months of life, oftentimes when people think of hospice care, they think of the last days. But what we want folks to remember is that call us sooner. Call us within those last 6 months of life if you have a family member that is dealing with a very serious illness, whether that's cancer, whether that's heart, whether that's just a long lifespan and they've at that last moment of life.
Mm-hmm. And it's really important to talk about this time of year because of the campaigns that you have going on. How can we all here support you all this time of year?
Well, we are receiving donations. Our new inpatient care center is a really big project. It's about an $18 million project. We're raising $13 million to support that project. We are in the throes of the fundraising campaign and we would love your contributions. Mm-hmm. They will go to directly impact care and our ability to build this beautiful facility.
And I didn't even want to ask you what you're already going to do next year. This time next year, you're going to be like, oh, now we're doing.
Yeah.
But I mean, the focus is really on this inpatient center. When do you hope to have it completed?
We hope to break ground next year in 2025.
We'll still be talking about it next year.
We'll still be talking about next year because we'll still be raising money for it next year. And we hope to open the doors in 2026. But it's a year-long campaign and we could use all the help that anyone is able to give so that our community can have a state-of-the-art facility for those facing serious illness and end of life here in our community.
I know you've been a part of Hosparus for many, many years now. Why do you continue to do the work with them, and what is it that makes you feel so passionate about the work that they do?
I believe that everyone deserves to have a good end of life. I believe that everyone deserves to have a special place that they can have those last moments of life. I feel like every family in our community deserves to have a team of specialized experts that can help you deal with those last moments. Mm-hmm. Next to our inpatient care center, we have our grief counseling center that's already there to help with that anticipatory grief. Also to help families now during this season that have lost a loved one in this last year. We are all grieving something and we want to be there for families, and I think we are the experts to do it. good, and we're providing a great way for families to get the care that they need.
It's always good to see you. Thank
You
you
too,
so
Claudia.
much. We'd love your help. You know, if you want to donate this giving season, all you need to do is use the QR code on your screen or head to hosparus.org/donate.